Hi, I'll be discussing about Chapter 6 for the laboratory, Specimen Collection and Processing Part 1. So, in the microbiology laboratory, we do specimen collection, particularly collection of blood, stool, urine samples, body fluids, and swab. So, what are the basic specimen collection that we need to remember? So first, specimen collects in an acute phase or before antibiotic administration. Okay? If during the fever, okay, before the fever or during the onset of the fever, we collect blood sample. And even before the antibiotic administration, we actually collect swabs, sputum samples, and also blood samples. Another, we select a correct anatomic site. So we select a correct anatomic site. Example, throat swab. Okay, swabbing. Another, rectal swab. Okay, so we choose a correct anatomical site. Another, we use a proper technique in collecting to inhibit the normal flora contamination. Note, example, during the throat swab, like we actually done in the laboratory, we need to actually have a minimal interaction with the saliva, especially during the throat swabbing. Okay, so if there would be saliva contamination, then there would be more normal flora than your than the actual bacteria that we wanted to isolate. So mas na makakakuha pa tayo ng mga normal flora na hindi clinically significant. Okay, kasi we know that in saliva, we actually can see many. Okay, we can actually see many bacteria. Okay, note, collect appropriate quantity. So even in not just in bacteriology but also in other section like clinical chemistry, hematology, quantity is important. So if there's no sufficient quantities, example of the urine sample, stool sample, or even blood sample, we can actually reject the specimen, and it is known as QNS, or quantity not sufficient. Another consideration that we need to follow is the packaging of the specimen. Note, the container or a transport medium must maintain the viability of the organism. Note, the container must not be tampered, nor it has leak on it. Another is a proper labeling. Note, the label must be in a complete form. No abbreviation, but in a complete form. You can actually reject a specimen or do not accept a specimen if there will be leakage. Leakage can actually coincide with contamination. There's a possibility of tampering the specimen, or there would be contamination or bacterial contamination. So it is safe to say to collect another, particularly if it is urine sample or stool sample. But if it is in a CSF form or the cerebrospinal fluid, so it's an exception that we need still to accept the specimen even it is contaminated or has a leakage. Next. Note, proper labeling is a must. No abbreviation. Kailangan gumamit din ng magandang ball pen or magandang pentel pen. Unang-una sa lahat, the label must be equal to the form that or the request form. Example, for the request form, you need to actually have the same information from your request form and to the specimen bottle. Okay? Note, if there would be unusual pathogens or agents of bioterrorism, So you need to notify the laboratory in advance. And if there would be positive, example, positive in Bacillus anthracis or positive in a panic um, in bacteria, okay? Example, you need to verify it to the doctor or tell it to the doctor. So, next, what are the specimen you need to collect inside the bacteriology laboratory? So, lesions, wounds, and abscesses, nasopharyngeal or throat swab, sputum samples, urine, stool, blood, CSF, other body fluids, and non-routine specimens are actually done or collected for bacteriology culture. It is you actually collect it to done gram staining or bacterial culture. So first would be the lesion or wound abscesses. Okay? For the wound abscesses, we are not actually using cotton swab. Why? Because it can be toxic to bacteria, particularly fastidious organism. What are the fastidious organism? The fastidious organism are your Haemophilus influenzae and then your Neisseria gonorrhea. Kapag kasi nangongolekta tayo ng mga ganon, yung mga fastidious, mabilis siyang mawala o mag-disintegrate o mamatay dun sa mga swab na yon or yung mga cotton swab. So, we are actually using Dacron or polyester swab. Okay? Before you can actually do the wound swab or swabbing, you need to cleanse the area first. So, first you need to have alcohol, cotton with alcohol, and cleanse the area. Okay? This is to avoid the normal flora in the skin. If you're actually doing a wound swab, you're actually avoiding the normal flora, which is Staphylococcus aureus. And then, you need to do it in a zigzag motion. Okay? So, it can be, after the swabbing, you need to place it in a sterile tube. So, if transport media is ready, or you can actually have a transport tube, so it's more good than a plain tube only. So, note it is advisable to have a needle aspiration of pus rather than the swab. Okay, if there is pus, you can actually do aspiration. Usually, pus or abscesses can be used in anaerobic culture. So, please take note that if you're actually using swab, this is not appropriate for anaerobic culture, but it can actually use for aerobic culture. Next would be nasopharyngeal and pharyngeal swab. Okay, these are just some of the ways to swab nasally or at the nasal and your throat. So first is nasal swab. So meaning in the nose. Okay. Throat swab. Okay, we actually done it inside the laboratory. Nasopharyngeal, it is both the nasal and going down to the pharynx. And nasal aspirate and then nasopharyngeal aspirate. First is the nasopharyngeal swabbing. So for the nasopharyngeal swabbing, you're actually dealing with a swab which has a flexible handle. Okay, a swab with flexible handle. So, like this one, it has a flexible type of swab. Okay? After you actually collect nasopharyngeal swab, you actually do a direct plating. Okay, direct plating on a selective media, which is your blood agar plate. Usually, nasopharyngeal swab is used to identify or to isolate the following organism. Bordetella pertussis, Haemophilus influenzae, and Neisseria meningitidis. These are commonly fastidious organism also. Next would be throat swab. In throat swab, you swab the posterior pharynx, tonsils, and inflamed area. Note, here at the throat swab, you're actually using a tongue depressor and swab the posterior pharynx. So this is the posterior pharynx. Okay? So, normal flora, commonly seen used when you're doing a throat swab, would be the alpha hemolytic streptococci. Some examples of this is to isolate your Streptococcus pneumoniae and beta hemolytic streptococci. Streptococcus pneumoniae or beta hemolytic streptococci. Next would be sputum collection. Sputum collection can be done using bronchoalveolar lavage, spectorate sputum or the Diff cup, or the induced sputum, or using the aerosol induction. So, that is your bronchoalveolar lavage using a tube to collect sputum sample. Okay. Next would be collection. How do you collect sputum specimen? So, instruct the patient to rinse the mouth with water to remove food particles or debris. But sometimes, we are not instructing this one, the tap water. We ask them to use distilled water because at tap water, you can actually have the non-tuberculosis microbacterium or the non-microbacterium tuberculosis, okay, organism. So, note, have the patient deep breath and cough several times to achieve the deep specimen. Note, we need the deep specimen or the sputum sample and not salivary. Salivary. So if the patient actually gives salivary sputum samples, so you can actually reject it. Okay. Patient should expectorate into dry and sterile container. So note, a sterile container is a must except use it when you're dealing with stool sample. Okay? Transport immediately at ambient temperature. Okay? Refrigerate if there will be delay of more than 1 hour. And before it is done, they must collect it 3 times first morning sputum for Mycobacterium tuberculosis. Okay? So, if you will be doing an induced sputum collection, 15% sodium chloride and 10% glycerine, approximately 10 minutes or until the strong cough reflex is initiated. So, yung asin, which is a 15% sodium chloride or your salt, and a 10% glycerine is used to induce the sputum sample. Okay. So, these are just the quality of the specimen that you can actually get when you're doing or collecting a sputum sample. It can be purulent, okay? So, you can actually see it mucoid type or purulent, kulay yellow, mucoid, yellow tapos sticky, bloody, may mga dugo-dugo, and salivary or induced sputum kapag kulay puti lang siya, okay, or clear. So, you can actually note the volume. You need to note if there is free from contaminant. How would you do it if you would accept or reject the sputum sample? This is by Bartlett's criteria. Under the microscope, you can actually do the staining, okay, or after the staining of the sputum or smearing the sputum and staining, you can actually visualize it if it has 10 or less than 10 epithelial cell per low power field or greater than 20 pmns or polymononuclear cells or low power per low power field. Meaning, if pag less than 10 epithelial cells ang nakita nyo, pero greater than 25 WBC ang nakita nyo, it is accepted. Pero kung baliktad, Kapag greater than 10 epithelial cell, pero less than 25 pMNS or your polymononuclear cells, then it would be a reject. So that is Bartlett's criteria. Note, you need to note the storage. Okay, dapat within 2 hours na process na. Kung hindi within 2 hours, ilagay sa ref. And then the transport. Okay? Next would be collection of stool sample. Collection of stool sample it can be done by rectal swab or collect stool sample. It needs to be a pea-size stool sample. Hindi kailangan drum o marami. Okay? Note, a negative result is not a sufficient to exclude bacteria or parasite. Ibig sabihin, kung nag-negative siya dun sa stool culture, then hindi ibig sabihin nun na wala talaga siyang bacteria o wala siyang, he or she does not have the bacteria or parasite. Note, there is need of 3 consecutive specimen. 3 specimen ang kailangan. To actually let you know kung ano, kasi possible na sa first negative, sa second positive, tapos sa second, sa third negative. So at least there is an ruling kung para makuha natin yung positive result. For the stool preservation, it can be buffered formalin or polyvinyl alcohol with zinc. Note, buffered formalin is used for parasitology. Note, for parasitology, but for the bacteriology, it's polyvinyl alcohol with zinc. Okay? So, if there would be a delay, refrigerate 2 hours 2 hours delay. If there would be delay, within 2 hours, kailangan na refrigerate na siya. For the medium, enteric transport medium, it must be in carried layer. Okay? For a transport medium, it must be in carried layer. So, what are the expected organism in the stool sample? Usually, it's Vibrio cholerae, Salmonella species, Shigella species, Escherichia coli O157H7. Okay, next would be urine collection. So for the urine collection, the specimen of choice is midstream catch or clean catch midstream. So this is a least invasive collecting urine sample. So note, advises the patient to have a first morning urine. Kung hindi makakakuha ng first morning urine sample, dapat the urine must be at the bladder for at least 4 hours. Okay? So, note, there is a proper collection of the urine during the midstream catch, clean catch. So, there must not be contamination of the urethral or urethra, particularly sa babae. Kasi usually, pag sa babae, there will be possible of contamination when collecting urine sample. Next would be straight catheterized urine. This is slightly invasive. This is a collection of bladder urine. So, note, there is a possibility that when you're collecting a straight catheterized urine, you're inducing an organism to the bladder. Okay? So, usually kaya nga yung midstream catch ang ginagamit because it is less invasive and then you're not introducing organism in the urethra. Next would be the suprapubic bladder aspiration. This is used for anaerobic, okay, anaerobic culture of urine. Okay, this is the introduction of needle through the abdomen into the bladder to collect urine sample. Bladder must be full before performing the procedure. This can be used in pediatric practice. Okay, so you're actually getting the urine sample in the bladder, okay, or at the bladder, urinary bladder. Next would be indwelling catheter or Foley catheter. Note, this is actually used, okay, when you're collecting urine sample for old age or geriatric patient. So the cons of this specimen collection are actually develop bacteria that can predispose them to severe infection. So there's a possibility na mag-induce ka pa ng bacterial infection. Okay. So specimen collection. A specimen container must be sterile. You need to autoclave it before using in the collection. So, it's preferably urine that is remain in the bladder for 4 hours has a decreased chance of false negative. Note, suprapubic bladder aspiration urine sample is tested for anaerobic organism and must submit in a syringe. Okay, do not actually collect it and then place or put it in a tube or in a specimen container. Okay, just submit the syringe. Next would be the specimen transport and preservation. So, for the urine sample, you can preserve it at 4 degrees Celsius for 24 hours if there would be delay within 2 hours. You can do urine transport tube containing boric acid to preserve the bacterial variability. This is used if there is no refrigeration or refrigerator or freezers. Next, you can also use urine preservative tablets, which actually contains also boric acid. If the transport or processing of the urine is delayed more than 2 hours, refrigerate the specimen. Repeat the collection if the sample is greater than 2 hours old, and if there's no proof of refrigeration or preservation. Note kung kunwari also there is a leak, pwedeng i-reject yung sample. Next would be blood collection. For the bacteriology, we're actually dealing with collecting blood samples in different sites. The right time to collect sample in bacteriology is before the fever. Before the fever, we actually collect blood samples. So, how do we collect blood samples? Okay, the skin at the venipuncture site must be meticulously prepared using a bactericidal disinfection. So you'll be doing iodine, you'll be putting iodine, next alcohol, and then first alcohol, iodine, alcohol. Okay, so that's the way to disinfect venipuncture site for blood collection for bacteriology. Okay, so for the adult, you need to actually have 10 ml of blood. Okay, so the dilution or the parts for blood and culture media must be 1 part of blood and 10 parts of your thioglycolate broth or the culture media. So it's actually 1 plus 9. Okay, it's 1 plus 9. For child, we're collecting 1 to 5 ml. It's 5 is to 10. Okay, it's 5 is to 10. Blood and culture media. So note, it is at least 2 blood collection should be done. Note, there is at least 2 blood collection in different sites. Okay, at least 2 blood collection. This is to actually get the bacteria. Okay? Okay, commonly, before, we are actually using thioglycolate broth. Okay? Because it can actually use in anaerobes and aerobic. Okay? So, this is actually used for atmospheric growth. So, this is an example of your thioglycolate or thio. Okay? So, this is an uninoculated medium. So, the thioglycolate broth has a pink color, which is the resasurin. Okay, it is the resasurin. This is a resasurin. Okay, so this actually inhibits the oxygen to go inside the medium. Okay, if the medium has pink, okay, the entire medium has pink medium, Okay, due to the resasurine, you need to boil it to drive off the oxygen. Okay, you need to boil it at 37 degrees Celsius or at the water bath to drive off the oxygen. Next. In blood collection, we can actually use sodium polyanisole sulfonate or the SPS. Note this is recommended because it would inhibit the antibacterial effect of serum and phagocytes. Okay? So, in the blood collection, ito yung nauuna doon sa order of draw. Okay? Note, the concentration of your SPS is 0.025%. Greater than 0.25% can inhibit the following organism. It can inhibit Neisseria gonorrhea, Gardnerella vaginalis, Neisseria, Streptococcus monoliformis, and your Peptostreptococcus anaerobius. Okay? So, it can actually inhibit the following organism. So, note, SPS can be also used for bone marrow and synovial fluid if you're collecting bone marrow. Other anticoagulant that can be used inside the laboratory, you can actually use Mycobacterium tuberculosis. Okay? You can actually use Mycobacterium tuberculosis. Heparin. Okay, you can actually use heparin for Mycobacterium tuberculosis. So, note, if there would be possibility that you'll be getting a blood sample to actually, to know Neisseria gonorrhea, Gardnerella vaginalis, Streptococcus, or Streptomonoliformis, and then Peptostreptoanaerobius, you can actually use 1% gelatin, 1%, okay, 1% gelatin to inhibit the effect of SPS. So, you can actually put 1% of gelatin. Okay. In the laboratory, we are actually not using citrate and ethylene diamine tetraacetic acid. Okay. Next. Next would be blood culture bottles. This is mostly ARD. It has ARD or antimicrobial removal device. Before kasi, pag kukuha tayo ng blood culture, kailangan hindi pa nagagamot yung pasyente. So, pag naggamot na, hindi na natin sila pwedeng ekstrakan. So, paano na natin malalaman kung tama ba, kung okay ba, kung may bacteria ba sila or sepsis sila sa dugo. So, now, meron na tayong tinatawag na blood culture bottles. So, this blood culture bottles has an antimicrobial removal. So, it has penicillinase to inhibit penicillin, okay? Magnesium sulfate to inhibit tetracycline, and p-aminobenzoic acid to inhibit sulfonamide. Okay? So, inside the laboratory, we're actually using blood culture bottles rather than using SPS. Next would be your cerebrospinal fluid. For the cerebrospinal fluid, we're obtaining it using the lumbar top. So, ito yung pinaka mahirap kuning sample for the bacteriology. So, if we'll be using CSF, the pathologist or the doctor would actually collect 3 bottles. One is for chemistry, one is for microbiology, and next will be hematology. So, yung una na makokollect, it is for chemistry. Yung pangalawa would be for microbiology, and yung pangatlo for hematology. Okay? So, note, as cerebrospinal fluid must be centrifuged, or you can actually do cytocentrifugation. So, the sediments can be used for gram stain and India ink. So, ano ba yung mga dinedetect natin for the CSF? if the patient has Haemophilus influenzae, Neisseria meningitidis, Streptococcus pneumoniae, Streptococcus agalactiae, if the patient has Cryptococcus neoformans that can be found in the CSF of commonly immunosuppressed patient. Karaniwan sa mga pasyente na may Cryptococcus neoformans is yung mga may HIV or human immunodeficiency. Okay? Viruses. Okay? Next. Okay, next would be transport media. Transport media is used not to have the bacteria to grow, okay, but to actually have a bacterial cell that is still viable after 2 hours. So, what are the transport media? So, note this do not promote multiplication of microorganisms. This is just purely preservation. Okay, this is purely preservation. So, these are some of the examples of your transport media. For stewards and amines transport media, this is used for upper respiratory tract specimen and fecal specimen. So this is also used for fastidious organism. Fastidious yung madaling mag-disintegrate or madaling mawala kapag naanuhan ng hangin or hindi tama yung environment. So some example of this is Neisseria gonorrhea and also Haemophilus influenzae. Next, charcoal contain, which is your amines. This is for your Neisseria gonorrhea and Bordetella pertussis. And Kerry and Blair for the gram-negative and anaerobe bacteria, particularly for stool. Next would be your Gembeck transport or transgrow. This is known as your James E. Martin Biological Environmental Chamber. So this is for the transport of Neisseria gonorrhea and Moraxella. So this contains sodium bicarbonate and sodium citrate. Okay. Labeling and requisition. So you need to know the label for the containers and the label for the requisition form. So in the container, there must be the name, okay, the complete name, identification number, room number if it is inpatient, physician's name, culture of site. Culture of site, if it is rectal swab, it can wound at the right arm, okay, blood culture or blood at the right side or right arm, okay, date of collection, okay, date of collection and time of collection. It is important to actually have it on the container. Next, at the requisition form, the patient's name, patient's age, okay, date or birth, okay, gender, okay, patient's room number, or the location, if it is outpatient or inpatient, physician's name or address, specific anatomical site, okay, specific if it is right arm, left arm, right limb, okay, so anatomic site is important, particularly in blood collection. Date and time of specimen collection, clinical diagnosis or relevant patient history, antimicrobial agent that received by the patient, and name of the individual describing the order. Okay, so specifically also, if in the requisition form, you can actually put kung sino yung kumuha ng swab, okay, or kung sino yung nag-extract ng blood. Next. So sometimes wala tayo nung facility to do the blood culture or the bacterial culture, okay? We're actually shipping the infectious substances. Particularly, ginagawa natin to if we are doing doing a reference laboratory referrals. In the Philippines, the reference laboratory is your RITM, okay? Sila lang din yung pinagdadalhan ng mga infectious materials. Okay? So, infectious substances are material known to contain or can cause disease in humans and animals. So, it can be number as 1, low risk, for high risk. And states, it is conducted by the U.S. Department of Transportation and the U.S. Postal Service. But for us, usually for this one, DOH, and then the RITM. Okay. The Research Institute for Tropical Medicine. Okay. So next. So you can actually see also in the shipping infectious substances that it has double, there is a double packaging, there is an outer packaging, and there is a secondary packaging. So there would be a primary receptacles, and then there would be always a biohazard label. So mapapansin nyo na mas secured siya, and then naka-detail kung ano yung nakalagay dun sa pag-ship ng substance. Okay, next is specimen storage. For specimen storage, okay, these are the following organisms that substance or specimen that must be at your room temperature. Okay, so your cerebrospinal fluid can be at room temperature only for 15 minutes. After 15 minutes or within 15 minutes, you need the CSF. Okay? Kailangan yung CSF ilagay sa incubator. What is the incubator setup? It is 37 degrees Celsius. Only if, okay, hindi nyo mapaprocess siya within 15 minutes. Kailangan ilagay nyo siya sa 37 degrees Celsius. Room temperature, what is the room temperature ulit? It is at 22 to 23 degrees Celsius. Okay? Pero depende ang room temperature. Depende kung nasa states ka o nandito ka sa Pilipinas. Kasi dito sa Pilipinas, ang room temperature mas mataas. Okay? Room temperature din kapag the specimen for anaerobic determination. Okay? Another, if the stool sample for Clostridium difficile within 48 hours or 2 days, it can be at room temperature. Another, at room temperature, you can actually have your synovial fluid, yung mga fluid, yung body fluids. Okay? You can have it at room temperature. Or you can actually have it at room temperature. So, body fluids, bone, inner ear, corneal scrapings, gastric aspirates, suprapubic aspirate of urine, which is an anaerobic determination, and prostatic samples can be at room temperature. So this can be used or this can be at room temperature. Ulitin ko ha, kung ano-ano ang mga pwede, yung body fluids, peritoneal fluids, okay? Bone, inner ear, corneal scraping, foreign bodies, gastric aspirate, suprapubic aspirate of urine, and prostatic samples can be at room temperature. Ino-note ko ulit, ang CSF ay room temperature only at 15 minutes. Only at 15 minutes. Next. Another thing pa pala, for the anaerobic determination, kung yung mga abscesses, yung mga pus or abscesses, kasi anaerobic determination specimen siya, pwede siya on room temperature. Next. Okay, refrigerator at 4 degrees Celsius. Note if it is not within the 2-hour period. Kung kunwari na-consume nyo na yung 2 hours, kailangan mailagay nyo na siya immediately sa ref. Sa 4 degrees Celsius. Our ref is roughly 2 degrees Celsius to 8 degrees Celsius. So, ano-ano ang nilalagay sa refrigerator? Okay? Or sa ref. Okay? Mainly, it is urine. The midstream catch, ulitin ko, the midstream catch, hindi yung suprapubic ka, kasi anaerobic yun. Next is stool sample. Okay, stool sample can be put inside the refrigerator. Stool culture for stool culture, and yung swab, particularly the rectal swab. Okay, at 4 degrees Celsius. Sputum sample, kapag hindi siya within 1 hour, pwedeng sa room temp. Pero kapag kunwari refrigeration, pag lumagpas na ng 1 hour, pwede nyo nang i-ref. Okay? So, swab, for the swab, example swab is throat swab, okay? Yung genital swab, it can be at 4 degrees Celsius, okay? Wound swab, or your lesion swabs, okay? At 4 degrees Celsius. Okay? So, next, for the catheters commonly the indwelling catheters and the straight catheters, it is within 2 hours, kailangan nasa 4 degrees Celsius na siya. Katulad din ng urine sample, pag midstream catch. Okay? And then, viral specimen can be at the refrigerator at 4 degrees Celsius. Another, if the specimen is needed for serology, example, blood, serum samples, okay, those things can be at negative 20 degrees Celsius, yung mga nangangailangan or serum used for serological studies. Okay? Another, if it is tissue or specimen with long-term storage, note for a 70, nagkamali ako, it is 70 degrees Celsius, negative 70 degrees Celsius. Pag tissue or specimen with long-term storage, it must be at negative 70 degrees Celsius. Another, if it is C. difficile, for the toxin studies, C. difficile or your Corynebacterium difficile, okay, or Clostridium, sorry, Clostridium difficile, okay, difficile, you need it at negative 70 degrees Celsius or stool sample for longer than 3 days. So, kung longer than 3 days yung after natin, we can actually have it inside the negative 70 degrees Celsius ref. Okay? Next is level of priority. So, for the level of priority, kapag kunwari kung ano yung dumating sa ating specimen, ano ba yung uunahin natin? So, in the laboratory, once we actually receive CSF, amniotic fluid, okay? Amniotic fluid, blood, brain, cerebrospinal and heart valves, and pericardiac fluid, it is at level 1. So, it has needed an immediate processing. So, siya yung uunahin nyo. Okay? Kasi sila din yung mas, kapag nagkaroon ng resulta or nag-positive, agad tinatawag sa doktor. Next would be the level 2. Sino yung mga level 2? Okay, sino yung mga level 2? It is unprotected and may quickly degrade or have overgrowth of contaminating flora. So, mainly it is for the fastidious. So, unpreserved are the body fluid. Okay, body fluid, example, peritoneal fluid, pericardiac fluid is level 1. Yung mga body fluids na wala dun sa number 1, yun yung pwede nating gawin, or it would be at level number 2 priority. Okay? The bone, drainage from wounds, feces, yung unpreserved na feces, sputum, and then tissue. Okay? It can be at level 2. Okay? Next, level number 3, kapag mayroong quantitation or you need to quantify it. One example of this are your catheter tips, urine samples, and tissue for quantitation. This level 4 is the preserved one, yung mga na may preservatives. So, feces that has preservative, example, has PVA or polyvinyl alcohol, urine which has boric acid, and swab in a holding medium. You can actually have it the last one to prioritize. So, lagi niyong tatandaan, the level 1, the amniotic fluid, the blood, the brain, the cerebrospinal fluid, and the heart valves and pericardial fluid are important. The least are those who have preservatives. If there would be swabs na wala sa holding medium, it is under the unpreserved. So, it's number 2. Note, if the swab is not in a holding medium or transport medium, it is under the unpreserved. Okay. When do you reject specimen? So, not all the specimen in the bacteriology lab can be accepted. So, first, check the label. Check the label. If the label of the specimen does not match to the information at the requisition, it is rejected. Number 2, if the specimen has been transferred at an improper temperature. Example, if the temperature is needed to be at 4 degrees Celsius, okay, kailangan in 4 degrees Celsius. Kung ang specimen ay kailangan nakatransport sa ice box, kailangan nasa ice box. Kasi kung hindi, madideteriorate or mawawala lang yung bacteria na kailangan nating i-isolate. The specimen has not been transported in the proper medium. Okay? Example, specimen for anaerobic bacteria submitted in aerobic transport. Example of this, ang request ng doktor would be anaerobic culture. For the urine sample, ang nadalang sample sa inyo would be midstream catch. So, hindi nyo tatanggapin yun. Another is your quantity of specimen is insufficient for testing. Note, there will be quantity na sufficient, pwede nyong i-reject kapag konti lang. And if the specimen is leaking, specifically pag urine. Pero kapag CSF, okay lang kasi mahirap naman talagang kolektahin yung CSF. Ang hirap mag-lumbar tap ulit. Masakit. Next, if the specimen transfer time exceeds 2 hours post-collection or the specimen is not preserved. So, kung hindi siya na-preserve, then reject. Note if the specimen was received in fixative or formalin, particularly if it is stool sample. A stool sample must be at polyvinyl alcohol with zinc if you're actually after. If you're after bacteria. If you're after for the ova or the adult form, you can actually use a fixative or a formalin. Okay? Magkakahalo ang parasitology at microbiology. The specimen has been received for anaerobic culture from a site known to have anaerobes as part of the normal flora. Okay? So, example, sa vagina nakuha or sa mouth, paano kayo magkakaroon ng anaerobic culture doon? Eh, alam naman natin na mayroong mga normal flora doon. Okay? If the specimen is dry, particularly if it's swab, if it is dry, it is rejected. Okay? Note, the processing of specimen would produce information that is questionable. One example of this is Foley catheter tip kasi usually it would induce also bacterial contamination. So, if there is more than one specimen is submitted for 1 day. Note, except for sputum or stool sample. So, please note, example, kapag kunwari urine sample, dapat isang specimen lang per day. Stool sample, except sputum and stool sample. One swab is submitted in a multi-level, multiple. Note, it is multiple requests for various organism. Okay, example, isang swab lang, rectal swab, gagamitin para sa anaerobic sa aerobic. Hindi naman pwedeng ganun. Okay? So, Dapat for swab, remember, if you're actually dealing with swab, it needs to be at least 2 swabs. 2 swabs for wound culture or 2 swabs for rectal swab. Okay? 1 for gram stain, 1 for culture. If you're actually dealing with anaerobic and aerobic culture, dapat kung swab, kasi ang swab, hindi naman siya ginagamit for anaerobic eh. Madalang. Hindi rin naman dapat kasi na-expose ang swab sa air. Okay? Next. Next would be observation. Okay? Once you actually see na okay naman pala, pwede pala yung specimen, you need to still observe it macroscopically and then microscopically. Okay, kapag swab or aspirate, kailangan makita mo kung nagda-dry up ba siya or kung okay pa yung swab. Mas maganda kasi na nasa holding area siya or nasa transport media rather than nasa plain tube lang. Okay? Another, if the stool consistency, note if it is form or liquid, bloody, or mucus. Okay? Volume. Dapat sakto lang yung volume. Fluid or any fluid or any body fluid must be checked if it is clear or cloudy. Minsan makakakita kayo ng urine sample na parang contaminated with stool. So, pwedeng yung i-check. Okay? Another, microscopically, you can actually see sputum sample. Remember the burlets? Okay, remember the burlets? It is less than 10 epithelial cells per low power field and greater than 25 WBC or neutrophils per low power field. Okay? So, microscopically, give them technologies and precision of infectious process. So, guide for workup, and it dictates need for non-routine or additional testing. Note, for microscopic, your sputum sample, your CSF is actually good, okay? Another thing is for swab, you can actually do microscopic or gram staining. It's not appropriate to actually do a microscopic analysis in stool sample, vaginal swab, cervix, and urine specimen, and then throat swab. Sa mga swab, bakit? Kasi for the vaginal, stool, and cervix, it has normal flora. So, baka mataranta lang kayo, akalain nyo may bacteria. So, hindi siya appropriate. For throat swab, sometimes hindi rin kasi it has normal flora. Okay? It has streptococci. So, meron tayong normal flora doon. But for the urine specimen, it's not routinely done, but it's actually good if you are actually if you're a good medical technologist, you can actually assess urine specimen microscopically. Baka kasi mamaya may mga bacteria or sobrang dami ng bacteria. Then, it is a way to actually assess kung baka mamaya may UTI na talaga. Okay? Pero it's not routinely done because urine sample is analyzed 24 hours. So, after 24 hours, makakakuha na kayo ng resulta for urine culture. Okay, so this is the end of the slide for the part 1 of specimen collection. I hope you will understand it. It is under chapter 6 of your Mayhon.